I could have gone straight because I talked to my friend. I go this way. Now I want to go back. And I'm stuck with what you do now. Yeah. Cola.
The water.
Cola del agua.
Well, water quality in Haiti, we don't know much about water quality in Haiti because in most developing countries, we don't have the data. What we know, and according to USAID statistics, is like 24% of the population don't have access to safe drinking water, and close to 64% of the population don't have access to improved sanitation facilities. And by improved sanitation facilities, we can be talking as simple as a latrine. So 64% of the population don't have access to a latrine in Haiti. So they have these, it's kind of like channels, and those channels go in between houses and sometimes across or aligned with this main street. So that's why when you're driving, you can see the sewage in these channels. In terms of public health around the world, safe drinking water and poor sanitation are kind of contributors to diarrhea. It's that we have like close to 5 billion cases of diarrhea in a year that are attributed to poor sanitation. And also we have close to 1.5 million deaths because of that. And that it's mostly in children children under 5 years old. So we have two main aims for this project. First, to identify contaminants in water, specifically in drinking water. And second, we want to examine the spatial and temporal variation of that contamination. This project we are building on Professor Laura Ayanari's previous work there. Mm-hmm. So her population studies in Cap-Haitian, and she has different neighborhoods where she has population that she has studied in terms of nutrition outcomes, right? So we went to all of these places and we collected sample of all these sources of water. So the next step was to go on, do some water quality testing and see how's the water. And because some water contaminants may affect the absorption and the metabolism of some nutrients. So that's the link to water quality and nutrition. So we basically have 5 different neighborhoods. And these 5 neighborhoods have different water sources. So some of them have pumps that have been built there by the government. Some of them have wells. And the wells are there, the people have built a well for a family or for a community, or the government have built a well for the family of the community or the community. We can map all the water sources that we collected, and we can show them in a map, right? So we will know what are the levels of contamination, how do they vary across a specific geographic area. So if we have areas where contamination is higher, we can target our resources better, right? Mm-hmm. Because we can see this in specific area. We can use this for community development. We can assign the right resources to the right areas, not just the same amount of money, for example, to every location when not everyone will need it the same. And I think as we go in this project and we look at the toxic metal content of the water here in Haiti, and then we analyze the biological, and maybe we can identify the main pathogens, that will help to improve the nutritional trials and other interventions that we do globally in all of these developing countries. It's a collaborative effort. Safe drinking water and improved sanitation, it's not going to happen with just one discipline. It's a multidisciplinary issue and needs multidisciplinary intervention as well.